Now we'll look at another this is kind of like part of the procedure. So sometimes when they want to image you, they might ask you to breathe in and breathe out. So I try to look at the two of them and the various reasons why they might actually ask you to breathe in or breathe out, okay, before they actually take an x-ray, all of that, you know. So we said that in radiographic imaging, sometimes they might ask you to breathe in and breathe out. So both of them are used strategically, you understand? It's not like they just decide, you understand? They use it for a particular reason. So effect on anatomy is for breathing in, that's inhalation. When you breathe in, of course, your lungs, the size becomes bigger, okay? Lungs expands, the diaphragm moves downward, the thoracic cavity enlarges, the heart and the mediastinum shift slightly, so it will reduce overlap, you know. So clinical use is used in chest x-rays, you know, used for the study of ribs, okay. Helps to visualize upper, you know, ribs more clearly, and also studying the diaphragm, okay, diaphragm motion studies. So these are different images taken, okay, when the patient was inhaling and when the patient was exhaling. So how about exhaling, breathing out? So the effect on the anatomy is for the lungs, it will contract the lungs, the diaphragm moves upward, the thoracic cavity becomes smaller, you know. So abdominal organs also shift upward. So it's mainly used for all those chest x-rays, okay, especially pneumothorax, if you want to dictate pneumothorax, you know. Abdominal imaging too, it will basically bring the organs up, so it will make it much more clearer. Also special studies like all those fluoroscopy and which is basically dynamic imaging, okay, where you are trying to like follow up the imaging back to back in real time, okay. So for the radiographer, you are supposed to give clear instructions to the patient. So instructions like, okay, they should, you know, take in the deep breath and hold it, and you're trying to supervise and make sure that they're actually doing it as you actually instructed, okay. So that's what, and it's also good that you tell the patients before the procedure so that they're not coming to something new, all of that, you know. So that's what we have for this.